Good evening. My name is Etta Delamar, and I want to talk about the wicked problem that I did a presentation on is for access to healthcare in America. So the executive summary is access to healthcare in America remains a critical concern impacting population health, economic stability, and social equity. Despite advances in medical technology and data interoperability, sufficient barriers continue to limit adequate, adequate access to care for many Americans. So, some key challenges. For health insurance coverage, millions remain uninsured or underinsured, resulting in delayed care and poor health outcomes. Geographic disparities. Rural and underserved urban areas often face shortages of healthcare providers and facilities. Affordability. Rising costs of premiums, out of pocket expenses, and prescription drugs restrict access for vulnerable population. Data interoperability. Fragmented health information systems impede seamless care coordination and timely access to patients' data. So, some recent initiatives focus strategy to enable scalability, real time access to high quality health data, aimed to drive improved outcomes and informed decision making. Policy efforts at federal and state level continue to address coverage gaps, affordability, and provider shortage. So here's some of the opportunities. Leveraging interoperable data and advanced analytics can enhance healthcare delivery, optimize patient management, and support value-based care. Continue investment in digital health, telemedicine, and outreach initiatives can reduce disparities and expand access, particularly to underserved communities. While progress is being made to modernize healthcare systems and improve data interoperability, substantial challenges persist in achieving universal access to high quality, affordable care. A coordinated approach involving technology, policy, and community engagement is essential to addressing these barriers and advancing equitable healthcare for all Americans. So, some key factors here and statistics about population effects by limited access to healthcare in America. So, underinsured population, as of 2022, approximately 27.6 million Americans, about 8.4% of the population, lacked health insurance coverage. This group is higher risk for delaying or foregoing necessary medical care. Underinsured adults. An estimated 41% of working age Americans aged 19 to 64 were considered underinsured in 2022, meaning that insurance does not adequately cover healthcare costs, leading to financial strain. Racial and ethnic disparities. Hispanics and Black adults are more likely to be underinsured compared to white adults. In 2022, about 19% of Hispanics and 11.2% of Black Americans was uninsured compared to 7.3% of white Americans. Rural and urban access. Rural Americans face significant barriers with normally 20% more than 30 miles from the nearest hospital or clinic. Rural areas also have fewer healthcare providers per capita. Cost related barriers. Nearly 1 in 10 adults reported not getting needed healthcare in the past year due to costs. Among those with coverage, high deductibles and out of pocket expenses still limit access. Delayed care. Approximately 33% of Americans reported delaying medical treatment due to cost concerns in 2023. And this rate is higher among uninsured and underinsured population. And then children's access. About 5.1% of children under the age of 18 lacked health insurance in 2022, impacting their access to preventative care and chronic disease management. These statistics highlights the persistent challenge faced by millions of Americans in accessing timely, affordable, and equitable health care. Addressing these disparities is vital for improving health outcomes and promoting social and economic stability. Here are relevant economic data regarding affected region and population with limited access to healthcare in America. The United States had a gross domestic product, a GDP, of approximately $25.5 trillion in 2022. And healthcare expenditures account for roughly 17% of the GDP, making it a major sector of the national economy. Rural regions, which are disparately affected by limited access to healthcare, contributes about 10% of the national GDP, yet have higher poverty rates and lower per capita income compared to urban areas. So, some economic consequences of limited access. Underinsured individuals are more likely to experience financial hardship, with medical debt being a leading cause of personal bankruptcy. Affected population may delay care, which increase long-term costs to the healthcare system due to advanced illnesses requiring expensive intervention. Disparities in access contribute to lost productivity as untreated health issues lead to increased absenteeism and reduced workforce participation. So, stakeholders' access to healthcare. Let's see. Here are the primary law. I'm sorry, stakeholders' access. So, our patient and members, individuals who rely on health insurance plans and services including Medicare, Medicaid, and employer-sponsored coverage, their access to affordable and timely care is central to the mission. Healthcare providers, physicians, hospitals, and allied health professionals who deliver the medical services to members. Effective collaboration ensure quality care and proper claims processing. Regulatory government agency at the federal and state levels, such as for the Medicare and Medicare services, state insurance department that oversees healthcare standards, privacy, and access. And then shareholders, investors who own shares and are interested in the company's financial performance, compliance, and sustainability. So here are some laws and regulations that's in place now. The Affordable Care Act, which is ACA, expand health insurance coverage, prohibit denials based on pre-existing conditions, and establish essential health benefits. Mandated coverage for preventative service without cost sharing. Health Insurance Probability and Accountability Act, known as HIPAA, governs the policy and security of patient health information, sets standards for electronic health records and data interoperability. Medicare and Medicaid laws. Medicare provides federal health insurance for people 65 and older and certain young individuals with disabilities. Medicaid joint federal and state programs offer health coverage for low-income populations. And then Children Health Insurance Plan, which is CHIP, provides health coverage for eligible children through state and federal partnership. Then we have Americans with Disability Act, ADA. It prohibits discrimination against individuals with disabilities in healthcare setting. And then we have Mental Health Parity and Addiction Equity Act. Requires equal coverage for mental health and substance use disorder services for medical surgical benefits. And then state insurance laws. States may impose additional requirements for health plans, provider networks, and consumer protection. So, coalitions to tackle access to health care. So, for internal stakeholders, clinical guidance teams offer clinical insight to ensure solutions meet members' needs, especially for vulnerable population. Customer service and member advocacy provide direct feedback for members from barriers to care and opportunities for improvement. Legal compliance and regulatory ensure new initiatives meet our healthcare regulations and patient privacy requirements. Um, IT and data analytics develop and support platforms that improve access, such as appointment setting, virtual care, language support, and so on. So, some external partners, community organization, connect the local agencies to reach underserved communities. Healthcare providers and networks collaborate to expand care options and streamline referrals. Technology vendors partners on innovation tools for remote care and member engagement. So let's talk about a well-known leader who worked on extensively to help the problem of access to care, and that's Dr. Paul Farmer. Dr. Farmer was a physician, medical anthropologist, and co-founder of the global health organization Partners in Health. Throughout his career, Dr. Farmer focused on bringing high-quality medical care for some of the world's poorest and most underserved communities, particularly in Haiti, Rwanda, and other resource limited settings. He is widely recognized for his innovative approach to healthcare delivery, which combined direct patient care with research, policy advocacy, and community partnership. Dr. Farmer believed that everyone, regardless of economic or social status, deserved access to effective and dignified health care. His work inspired new models for community-based care, integration of social support and health system, strengthening key strategies in tackling the complex, wicked problem of healthcare access on a global scale. Dr. Farmer's legacy continued to influence healthcare providers, leaders, and organizations worldwide as they strive to close the health gap and access and equality. So, what worked? Um, Here's a summary of what worked and what didn't work regarding Dr. Farmer, for example. What worked? Community engagement. Dr. Farmer's approach involved working directly with local communities, listening to their needs, and collaborating with local health workers. This helped build trust and ensure intervention were appropriate and sustainable. Integrated health models. He implemented comprehensive care model that addressed both medical and social determinants of healthcare, such as poverty, nutrition, and housing, leading to better health outcomes. Training local staff. By investing in education and training of local healthcare professionals, he helped create lasting capacity within the community. Global partnership. He built partnership with government, NGOs, and academic institutions to secure funding and resources, which allowed projects to scale and reach more people. What didn't work was resource limitations. Despite successes, Dr. Farmer often faced challenges due to limitation funding, shortages of medical supplies, and infrastructure constraints, which sometimes slowed progress. Systematic barriers. Deep rooted systematic issues such as political instability and inadequacy, healthcare policies made it difficult to sustain improvements in some regions. And scalability. Some interventions that work well in small communities were hard to replicate at the national or global scale due to differences in context, resources, and governance. These lessons show that while community focused integrated approaches can significantly improve healthcare access, larger systematic and resource challenges remain obstacles. Continuous adaptation, collaboration, and advocacy are necessary for lasting impact. So here are some suggestions of tackling the wicked problems. One, so fostering cross-functional collaborations, I'm sorry. Establish coalitions that include clinical, technology, legal, compliance, and customer service teams. This ensures diversity perspectives are considered. leading to comprehensive solutions that address both operational and member needs. Leverage technology and cloud solution. Accelerate the adoption of cloud technology to enhance scalability, reliability, and efficiency of healthcare platform. This support innovations such as telehealth, remote monitoring, and data analytics, which are crucial to reach an underserved population. Streamline processes and reduce administrative barriers, simplify intake appointment scheduling and member communication by automating routine tasks and integrating systems. This reduces wait times and make it easier for members to access care. Address social determinants of health. Partner with community organizations to provide resources that go beyond medical care, such as transportation, nutrition, and housing support. This holistic approach improves health outcomes and reduces barriers to care. Engage members through education and support, and offer clear guidance and proactive outreach to help members understand their benefits and how to access services. Digital tools and support can improve health, literacy, and engagement. And then finally, measure impact and adapt continuously. Implement robust analytics to track access metrics, identify gaps, and address strategies based on real-time feedback from members and providers. By combining these strategies, organizations can make meaningful progress in improving healthcare access for our population. Thank you for your time today.